just finished another incredible 3.5 days with the Freedom Awaits program. I'm with a really dynamic guy, Dr. Trivedi. Dr. Trivedi, congratulations.
Thank you.
It's been incredible having you here because everybody's unique, but you have this level of energy and this level of intensity about you that's pretty special. And I think what I would really appreciate is tell us a little bit about your practice right now. What kind of a practice do you have? What kind of volume do you see? That type of thing.
We have a very open subluxation based type practice. We see anywhere from 500 to 650 depending on what's going. Our practice is good. It's a lot of fun. It's very high energy. It's very reflective of my energy. And it's great. It's a great time through what we do. I mean, I enjoy going to work.
Absolutely, and I can tell that.
Yeah.
I can tell that. So, what made you decide to do the Freedom Awaits program?
Results.
Okay, all right. Well, define that a little bit, results.
For me, our decompression it has been a little bit slower than I wanted it to be, and there's always been an uncertainty with decompression. When it comes to chiropractic, we study it, we know the business of chiropractic. I've studied the business of chiropractic since Try 1. So to get into the business of chiropractic was not as difficult because you understood it. However, the business of decompression is a whole different animal. It's a whole different animal, and when we try to do the same thing we do with chiropractic with decompression, it's a little bit more challenging. It's a little bit more challenging. And so for me, I had some friends that had been through the program, and they just said, do it. And I don't like to reinvent the wheel.
Well, you certainly do not have to reinvent the wheel anymore, do you?
No, not at all.
Let's see here. So you've got a high-end table, correct?
Yes.
Okay, very high-end table. That means a very expensive table. And you were taught how to use that table by the manufacturer, right? And one of the things that we taught you here was our protocols and how to use the tables to their best possible result. Okay, did you learn some things different in that area?
You know, I believe there's a certainty that I know that I have with my adjustment. There's a certainty that comes through with that, so it doesn't matter because I know that I can help that person. However, with the education and the training that I was given by the table manufacturer, didn't leave me with that. So I would put people on a table because we could sell, but the result that came about from it was not what I wanted for my patient. And so learning how to take care of the patient brings back that certainty of how to take care of the patient at 100%. That in itself is going to resonate to such a higher frequency as going to bring people through the door.
Absolutely. That's very well said. So you learned some good stuff on protocols here then, right?
Absolutely.
Okay. So did we address clinical issues well here at this program?
100%.
Okay. Doing our program, one of the things that I remember specifically talking to you about was the fact that we don't use any form of enticement in the way of a free adjustment, a free examination, not even a free consultation to get patients into our practice here.
Mm-hmm.
And I also told you that there's virtually zero selling involved.
Mm-hmm.
Okay. What would you have to say about that with regards to what you've learned here?
There is no selling. There is no selling. There are many times that I have felt and have been called a salesman. My brothers used to say I can sell ice to an Eskimo. But if you don't need to sell and you can do what's right for the patient, that's why we're in this game. That's why we're in this, to help people. And selling turns people off. And by doing it the way that the program teaches you, you can take care of the patient at still the highest quality and the highest level without them or yourself even perceiving yourself as a salesman.
Beautiful. That was very well said because that's exactly the way We do it. That's the way we are. There is virtually no hard sell at all in our program. Yet, we tout ourselves as having a completely perfected decompression practice, and you can see that now, right?
Mm-hmm.
Okay, as everyone knows, I've done these interviews. I pick people occasionally to do these interviews with, and they're totally unscripted. So I never even know what I'm going to ask. I just get up here and kind of go with the flow. And we've got a very incredible guy here that's got a high level of intensity, and we've gained a nice bond since he's been here. And I know this guy's going to do big things. But I guess probably the way to end it off is that you have been in practice for how long now?
3 years.
3 years. And he is kicking butt. I mean, kicking butt. Just want to validate him a little bit because I think it's important. A picture's worth 1,000 words, all right? When you come in here and you do this program, you see, feel, and experience something that you could never get in a classroom setting, okay? Mm-hmm. Right? Mm-hmm. And so that contributes to the level of certainty. When you see that you're in an office that has been doing this year after year after year after year, it's not just a short-lived 6-month run or a year and a half or a 2.5-year run. It's a year after year after year. We've got virtual predictability in our new patients. We got predictability in our patient outcomes, and we got predictability in our monthly income. And we have a pristinely organized office that allows us to enjoy our life, have the kind of respect and the reputation that I believe anybody would want to have doing a business or a practice like this that's centered around helping people. Mm-hmm. Would you agree with that? Mm-hmm. Okay, so the question I have for you is this. Is there anything that you can say to end off to anybody that might be listening to this or looking at this that you think would be important for them to know?
I've been to a lot of seminars, and when I mean a lot of seminars. But a seminar is a seminar. It's not reality. It's not the day-to-day operation. Because someone can get up on stage and feed you whatever you want to hear. But when they go back, they do something different. That's what I call a theory-based management company. This is reality. You walk into this office, and not only do you see Dr. Bush doing what he does, but you see the team effectively running the operation the way that you want it to run. So it's not someone telling you on a stage that this is what you need to do because this is what I do, and then they go home and do something different. That's unethical to me. And I've been through it, I've seen it. But here, for lack of better words, there's no BS. This is what it is, this is what we do, and this is how it's done. It's very black and white. Not, for a person like me, that makes a lot of sense. And what I appreciated is that we got to see that operation. Because I know that if I went to a decompression seminar, great, I would have been raw-rod, but I don't want to be raw-rod. I can create that myself. I want to know.
Yes, you can.
I want to know the nuts, the bolts, how to put it together, and how to take care of my patient at the highest quality that I can. And because those patients are the same patients that are going to go out into my community and ring high praises of me in my office.
Well said. Well said. It's been a pleasure. I look forward to working with you.
It's going to be great.
All right. Thanks.